12 minutes past 8. Good morning. My name is Ifiemi Andrew. Today, our conversation on the Morning Crossfire is targeted at development, particularly in the health sector, and not just any part of the health sector, but the primary health care sector. And we are basically going to address some of the issues in that area. One of them, heavily, we will be dwelling on, is the case of workforce in that area. Now, there's been lots of complaints about unavailability or not enough manpower in the primary healthcare facilities scattered across Rivers State. Why is that so? What are the possible reasons why we have this situation? All of this will form our conversation this morning, and we will be speaking with a serving primary healthcare worker in Rivers State. Is also the national president, Primary Healthcare Workers Association of Nigeria, Daniel Edwin Atiemie. Sir, you're welcome and good morning. Thank you for joining us.
Thank you, Mr. Ifiemi Andrew.
All right. First off, let us start with how are things going with workers at the primary healthcare sector? I'm sure you're having it good.
Yeah, the primary healthcare sector workers, I can say, we are having it fairly.
Fairly? By fairly, you mean?
We are having it fairly because there are still other issues that are yet to be resolved. But I think I want to give kudos to the government for addressing most of our issues, especially remuneration.
Okay. So that simply means there's more that you expect the government to do beyond what it has done already in that regard.
Exactly.
All right. Now, talk to us about a very popular concern we've heard, and this is something that's been raised by a lot of Rivers people who visit these medical facilities in the various communities to get medical care. And they tell you things like the workers are not there, nurses are not there. And even when you have some few nurses available, they are overwhelmed. In other cases, there are even not enough materials for them to work with. What is the situation what is the standard? Let's start with that for the workforce in a primary healthcare facility.
Well, for instance, the area of material is purely management issues, but I will address especially the key areas that has to do with workforce, because when workers are inadequate, the workers that are there, the few ones will be overwhelmed, and that borders on welfare. So it is on that I want to comment fairly on the shortage of workers. Now, in Rivers State, as I speak with you, like you rightly said, the health sector, and you narrowed down to the primary healthcare sector of Rivers State. Now, in the health sector as a whole, we have the problem of shortage of staff, manpower. Yes, there is presently inadequate manpower to man most of our health facilities. But thank God, the governor of Rivers State, Sim, has done some part in the Rivers State, the state government level. That is Rivers State Healthcare Management Board. As you are aware, as a media person, you know that recently a promise of paying all the arrears. It means unemployment was done in that sector. So I'm not going to talk too much there. I just laid the brief background. Now, let me narrow myself down to the primary health care where I work and function. So the primary health care in Rivers State, as I speak, all over the 23 local governments are short staffed. We actually need employment for new staff to to fill in the gap. You know, we are short-staffed because of few factors like death. You know, every human beings will die. Then the second factor is retirement. The third factor is greener pasture. People are leaving the service to other areas for greener pasture. So these three basic factors have led drastically to shortage of manpower in the primary healthcare sector of River State as we speak. Now, the aftermath effect of this shortage of staff is telling seriously on the workers who are working. For instance, a health post will have a minimum of 5 health workers. The least health post is a minimum of 5 workers. But as we speak, presently, we have less than that in most of the rural health posts. If you come down to the primary healthcare center, the staff are also inadequate. If you go up to the model health centers like the one former governor Messi developed and built in all the LGs, you know, those class of health centers need a lot of manpower, ranging from 50, let me say from 70 to 100 if there are enough staff, because the medical laboratory section, people will be working, the immunization section, people will be working, the nutrition unit, social mobilization unit, the environmental health unit, the community health unit, and the pharmaceutical department. A lot. And now we lack these manpower. So it is really telling on us. Now, as a program and as a widely heard radio station, the Nigerian Info, I want to quickly call on the government and government functionaries that are listening to this program to do something immediately in order to, cure this defect in the system.
Okay.
If nothing is done, I'm telling you that the primary healthcare system will be leading to extinction.
All right.
But we will not get to that point.
From all you said, let me ask this. A lot of nurses graduate every year. A lot of them. So how come we are lacking nurses in these facilities across the state? And secondly, there's the report also that some nurses that are even posted to some of these facilities in some of the communities refuse to go there. They don't want to work there. If that is true, why? And how can we change it?
Now, basically, the primary healthcare sector, to be frank, it does not require the posting of too many nurses. You know, nurses are trained for secondary health care. They only come in the primary health care to help some technical areas because of their expertise. Now, what the real manpower that is required is this: when you hear they are trained from College of Health, Science and Technology and other university. Community health. Those community health are the people. In fact, if you look at the community health outstanding order, before we normally call them where there is no doctor. It means these are the people that have competent jurisdiction in administration of primary health care. So if you lay emphasis too much on nurses to be posted in the rural area, especially when it is not a hospital per se, then I think we are moving towards let me say, arbitrariness. But the core people we are talking here is when you go there, you meet the medical doctors. But this one now, when you get to the rural health post, a rural health post does not have a medical doctor as a technical head in every health center. So where there is no medical doctor to commence diagnosis and recommend for the necessary test, you fall back to a community health worker, well trained in that health post. And the community health will now take their history and then.
But from what you are saying, even for the doctors, how many doctors do we have posted to some of these hospitals in the communities that go there? Because there are reports that some of them don't go there, and there are many reasons. Some people say they don't have a place to stay. Some people say, oh, this place are not safe. Some people say, oh, the development in those areas are poor. There are even talks of people sorting to see that they are not posted to certain local government areas or some communities in some local government areas. There are those that are posted that don't even report to work. They don't report to duty. Do these things happen?
That one is not very correct. To straighten the record, the primary healthcare system is such that we have one doctor as a head. We call him the MOH. MOH means Medical Officer of Health. Now, depending on how large the LGA is, for instance, you cannot compare Obiakpo, the likes of Obiakpo, Port Harcourt City local government to some other local government that are rurally based. Now, depending on how large the local government is, there are other doctors that are heading each of the model primary healthcare center, and they are reporting to the MOH, who now report direct to the board. So, to say that doctors don't go to work, no. If you talk about a rural health post, there are doctors may not be posted there, so that community health and other health workers, they work and report to the medical doctor in charge of the primary health care center or comprehensive health center, who in turn report to the MOH. That is the ladder of our reporters in the health system.
All right, the phone lines are buzzing. I'm sure people have questions they want to ask, and people will want to tell you otherwise. I'm very sure of that. However, let's take this very short break. Stay on the line for us. When we come back, we'll go straight to the phone lines.
All right.
Good morning.
app. Experiencing any bugs? Worry no more. Just click on settings and turn on the button which says always use highest available audio quality, and that's it. No more bugs. 92.3 Nigeria Info FM, your number one talk radio station.
This is the Morning Crossfire on 92.3 Nigeria Info.
All right, good morning. The conversation continues. My name is Ifiemi Andrew. If you had been following from the start, we had just talked about the primary health care system and the situation with the problem with a lack of adequate manpower. And my guest, the National President, Primary Healthcare Workers Association of Nigeria, and also primary healthcare worker in Rivers State, the president of Daniel Atiemie, Edwin, said quite a lot in the first half of our conversation. Hello, Mr. Daniel. Thank you for staying on the line. Good morning again.
Yeah, I'm with you.
All right. So, and he said quite a lot. For those who missed it, please go on Facebook at Nigeria Info 92.3 PH and then watch the whole thing all over again so you can properly make your contribution. Some of the things he said was that it's not entirely true that nurses or doctors do not report to work to areas that they are posted. And also, correct me if I'm wrong, but the primary place is we shouldn't focus too much on sending nurses to those primary facilities in communities. I'm correct? Yes, that was what you were implying.
Exactly.
All right. Amongst many other things that he said, however, we'll get your thoughts on it because there are several complaints that have come from you, the listener, in some of the communities across the various local governments in Rivers State. Chima Ezenye says community peace and good relationship with host communities should be promoted. Okay, this person is watching from Enugu State. All right, let's go over to the phone lines now. 0817-923-0002, 0817-923-0003, or 0817-923-0007. With regards to welfare, he says, well, the government has done fairly when it comes to salaries and arrears and all that payment, but there's a lot more that needs to be done. And also had hinted on the issue of tools to work with is entirely a board thing, management thing, he says. But let's go over to you and take some of your questions first before we continue. Good news is in Port Harcourt. Hello, good news. Good morning.
Yeah, good morning, my brother, man.
Yes.
Quick one. First of all, let me appreciate the man in the studio talking. But all he said is not totally truth. I know that the government has failed somewhat in concerning the primary health sector. After the time of Amechi, I know that doctors are lacking, nurses are lacking, but the ones that are working. Give an example. I took my daughter to Omagwa Health Center. One day, last month, back, just this October now, I think, or October, September, something like that. That week, Monday, the doctor wasn't on seat. Tuesday, she wasn't on seat. When we compared, they said the doctor was doing something in his own clinic. And at the end of the month, they will collect salary. Haba. Which help us as much as we know that the government is not doing what it ought to do. My name is Goodies from Port Harcourt.
Eze Ken from Ubimini. I hope, Mr. Daniel, you're jotting down so that when you want to respond, you can respond to the questions adequately. Yes, Eze Ken from Ubimini, good morning.
Good morning, Ifiemi Andrew.
Yes.
Greetings to your guest.
Mm.
Ifiemi, I want to quote your guest wrong. Come to Ubimini Health Center or Cottage Hospital, as they usually call it. We have only one staff. Even if they had been posting, but none of them. I don't know if you get me.
Mm.
Our health centers are suffering the same thing as the educational sectors. They post their staffs, and you go to the place, you will not see any staff. Instead, you see only one doctor. So I don't know if really your guest had supervised or did all the hospitals in the nooks and crannies in River State, or he is only based on the municipal, the Port Harcourt municipal or the urban areas. He should go to rural areas where the villagers are suffering. Because, see, let me tell you, Mr. Ifiemi Andrew, the private maternities and the chemists, pharmacies, and so on and so forth are the people having what they need to have in the health sector. So let them buckle up, and then let the rural areas know that there is importance in healthcare. Thank you very much.
Dakuku in Atiemie, good morning.
Hello. Good morning, Ifiemi Andrew. Good morning, Nigeria Info.
Okay, Dakuku, go on.
This is Dakuku from Ifiemi. Let me go straight to what you're saying. Our primary health care have already, after Atiemie left office. You know, me and you are in this river state. We are assessing our primary health care. I think we are where we are facing water. Because Atiemie did it for river people to enjoy. Even if the general hospital was being funded well by Atiemie, when you go there, you see a lot of adequate manpower. The nurses, the doctors are there. Work every day. After left off, it was neutralized. Okay. All of them have been looking at the community.
Dakuku, we're actually struggling to hear you.
Let me tell you, the area have come down. The general hospital, general hospital. You will not even believe that this general hospital. But Atiemie was beating into the court incident happened to him. He left. Primary health.
All right. Okay, Dakuku, thank you. I think we got part of what you were trying to say, but it was difficult to understand you entirely. We just got parts of it, and I'm pretty sure it's in same line with other callers. Okay, Temple is also in Atiemie. Let's hear if Temple will say the same thing. Good morning, Temple.
Good morning, the very distinguished Ifiemi Andrew. Doing this morning.
Fantastic. Go ahead, please.
I think the question you ask is very much simple. Some of these nurses, workers or staff, some of them are posted from far places. And you cannot be working, and at the end of the day, part of, let's say, 70% of your pay is going on transport. What the government, I think they should do, build some good quarters that will accommodate the staff, very much important, and create good enabling environment. Because the same thing is applicable to teachers. Some of them are being posted in some rural areas. But if you look at where they are coming from, my brother, in, let's say, 5 days, some of them go to work 2 or 3 times in a week. And for me, you know the implication. So government should, provide a good quarters that will house these people. And while provide security as well. And make it, will I say, lucrative or maybe attractive for them. Because you cannot say somebody is working at the detriment of his own life. So the government should do the needful. Because if you look at them also, government personnel, they are being given some kind of a good quarters that makes them, at the end of the day, when they are being given appointments, their life changes. So the life of this staff should also translate to what they are, doing, because they cannot be saving life. And at the end of the day, their own life is not secured. It's as simple as ABC.
Temple, thank you. I like how you put the last part. The way we have quotas for judges, for lawmakers, for all of these people who are also civil servants for a period. Same thing should apply to other people who work in the civil service at different levels. Makes sense. Let's go to Emeka first. Emeka is in Elele Alimini. Emeka, good morning.
Ifiemi, good morning, my dear brother.
Yes.
There is no manpower in all primary health centers. There is one that I visited last week. It's only.
Which one? What's the name of the one you visited? Hello, Emeka. Can you hear us?
I can hear you.
Okay, I said which one did you visit?
In particular.
Because of my own safety, I don't know what company is doing. But I can tell you to them.
Your safety. Who is coming to attack you because you are telling us what you saw in the health center you visited?
Not to come from there and be telling you this.
Okay, send a message. Send a message about that one then. Go on. Oh my goodness. We're struggling to hear you. Although Emeka, if you can, please, you can call back. 0817-923-0002, 0817-923-0003. You can also call us up on 0817-923-0007. So any of these numbers you can call to get through to us. On Facebook, we are live at Nigeria Info 92.3 PH. That's the handle. Odepeli Gosoka says, I greet your guest, but you didn't say anything beyond that. On WhatsApp, you can send messages to 0809-030-6416. That is the WhatsApp number. We're taking some of your calls on WhatsApp as well. But let's go to Bori first. Late Ambari, good morning.
Yeah, good morning, Ifiemi Andrew.
All right, go on, please.
Yes, I think the issue of these health workers has been a very bothering one. And the management themselves has not, taken that due course that they need to make a change when it comes to, service to humanity in that health center. Even if the government happen to pay them, I see some lapses in their own side too. I think the only problem we have is that they didn't pay them money or maybe give them what they deserve or maybe areas where they are coming from. But in rendering service to the public, how has it been? Are we really getting it right? Because government can see your competency in handling issues and they will say, okay, everybody will see reasons to say, government, consider them. In their own side, how have they handled it? Is it only to complain about money? I'm not saying that it is bad to complain about money, but how? Because we know about some of these health centers, from UPTH, the state-owned and all that, the primary health care, how it has been handled, how they render services to people. They are not serious. Even when they were paying them, they've not started this complaint. You will go there, patient will, in fact, to attend to patients is a problem. Different taxes for patients. When you go there, even if you have a card, the amount they will tell you, Ifiemi, we need to talk to these people, these health workers, to also know how to handle their own side. So that we have always been agitating for health workers. We that are commenters, we have always agitated for them. But the service they give to people, it has not been conducive. I must tell you this, they should iron their own side of it. So that when we are talking, we will talk based on the fact that we see, their concern for humanity. This is the only area I just want to add.
All right, Leighton, thank you. Ida from Nkora is on the line. Good morning, Ida.
Yeah, Andrew, good morning.
Yes, so good morning.
Yes, I want to thank you again. Health is wealth. My brother, if you come to my community in Nkora Kingdom, I always say this my brother, the place is very, very bad. I'm pleading with the Commissioner for Health. It is in Nkora Kingdom. We don't have a good health center in Okupu Nkoro. Please, the governor should do that. By the time you take somebody, a pregnant woman down to Buri, she might deliver inside their motor. By the time you take a sick person, Buri, it will be very difficult because the road. I know the road is okay, but they should please bring a standard health center in Okupu Nkoro. And they are talking about that you go to UPTH or BMH, my brother, the place is very, very dirty. So over there, they should take care of health centers. Please, I want to should be equipped that will not traveling out. Please, they should use river money for river people. I want to commend the Commissioner for Health. He's doing very, very well. Adedore is doing very, very well. And the governor should please put more money in health sector and education sector. Because without education, you cannot go to health. You cannot know anything. Please, our teachers should be paid very, very well. Our schools should be furnished. Please. Andrew says, I'm going to Korokito to video the primary school and the secondary school and the health center. Send it to you. Thank you very much.
I'm waiting. Thank you, Ida. 0817-923-0002, 0817-923-0003 or 0817-923-0007. Mr. Dan, quickly, let's get your response to a few of the comments made. I mean, you heard most of them say that what you have been saying is not entirely correct. That's not the true situation on ground. So,
yeah, I have heard them, and as a very quick reminder, I limited myself to talking about primary health care services in River State, not hospital. So when you mentioned the hospital, like I earlier said, I do not have jurisdiction to speak on that area. So based on that, the issue they were saying doctors are not going to work, I still want to contend and correct that the was posted in primary health care centers in River State going to work based on their posting. Then the third one is talking about primary health care staff inadequacy. Yes, I agree with that fellow that we are lacking workers as we speak. We need something. Government needs an intervention in this primary health care sector. And let me say one thing very important, Ifiemi. Any government or society that joke with primary health care sector is to their own health peril, because the primary health care is the fulcrum of all the health care services in the world. Then the building of good quarters like Temple Okere rightly submitted here. He has done the work easier for me here. Yes, you have to create a conducive and enabling working condition for these workers. Like I earlier said, when we are short-staffed, the few staff will be strained. And the aftermath of that training is counterproduction. Yes, the people will be counterproductive. So when conducive environment is created for us, including welfare, like as I speak, there are some outstanding arrests from 9 months to 16 months. All the primary health care workers have not been paid. So that is another area. Then for Emeka, we couldn't hear him very loud and clear. Then Leighton Barry, I want to say that the area you are talking, I want to add that primary health care in River State has improved. As I speak, minus Lagos State, primary health care in River State is the second in Nigeria.
But doesn't that tell how poorly we are performing if by the standards, what we have, which is considered bad, is seen as second best? That would mean that the country is in sorry to say, but a mess in that aspect. Hold on. Before you respond, just let's hear from Jude in Omuma. He's been waiting on the line. And then you conclude with that. Jude, good morning.
Good morning.
Yes.
I thank you, I guess, who has come to talk about the health sector, deteriorating health sector in River State, particularly as it concerns primary health. I thank him very much. Government has to do something concerning the health sector. Now, in Omuma, I guess your man there knows that in Omuma as a local government, we do not have functional health center in a local government. Our people have to go to the neighboring state for minor health problems to be taken care of. They have to go to Abia. Not even one functional primary health center in Omuma. And you know what that means? The government has to do something and make it build a good number of them almost in all the wards. But now, none is working. Our governor do something to the health sector. See Omuma as a local government, and we need to be treated the way is taking care of other local governments. Please.
All right, Jude.
Functional health center in Omuma local government.
Thank you very much. Because of the time, Mr. Daniel, in few seconds.
Yeah, so my take or final submission is that the primary health care is very important, and River State government, who is now second in primary health care service delivery in Nigeria, should continue their good work. Our management staff in the primary health care management board should continue in the pace they are going, and we want to make sure that all killer diseases, immunizable diseases that will make the general hospitals or other tertiary hospitals strength, we have to immunize them and kick them out. For instance, like polio, it is very far from us.
All right. Thank you very much, Mr. Dan, for your time. I would hope to keep in touch. And as things continue to unfold, I'm pretty sure you'd fill us in. Have a great day.
Thank you.
Thank you. And thank you very much for participating. For those of us who have questions or you missed the conversation, go back to Facebook at Nigeria Info 92.3 PH and you get the opportunity to listen all over again. My name is Ifiemi Andrew. Good morning.
Salam